Good afternoon. My name is David Fitchett. I am a cardiologist at St Michael's Hospital in Toronto, Canada. It is my pleasure to introduce my review paper that discusses the role of Rivaroxaban in the management of acute coronary syndromes. Patients with acute coronary syndromes continue to be at risk for recurrent ischemic events despite an early invasive strategy and the use of dual antiplatelet therapy. It is known that the anticoagulant pathway remains activated for a prolonged period after an acute coronary event, and consequently, the anticoagulant pathway is a potential target for treatment. Early studies with warfarin indicated a benefit in patients with myocardial infarction. However, the risk of bleeding and the complexities of warfarin anticoagulation resulted in little use of this strategy. Subsequently, new specific inhibitors of anticoagulant factors 10A or thrombin, such as dabigatran, Rivaroxaban, and apixaban, became available for the prevention of thromboembolism. Studies with dabigatran and apixaban in acute coronary syndromes have shown no clinical benefit for the prevention of recurrent ischemic events, yet both agents increased bleeding. The ATLAS ACS 2 TIMI51 trial investigated the effect of Rivaroxaban in patients with recent acute coronary syndromes receiving current management that included both an early invasive strategy and dual antiplatelet therapy with aspirin and clopidogrel. The patients were followed for over 1 year. Rivaroxaban 2.5 milligrams twice daily reduced the combined endpoint of cardiovascular death, myocardial infarction, or stroke by 16%. Both cardiovascular and all-cause mortality were reduced 20%. Although major bleeding increased from 0.6 to 2.1% and intracranial hemorrhage from 0.2 to 0.6%, there was no increase in fatal bleeding. The addition of Rivaroxaban to current treatment with dual antiplatelet therapy using aspirin and clopidogrel is now an option for the management of patients with acute coronary syndromes. Both recurrent ischemic events and cardiovascular and all-cause mortality are reduced with Rivaroxaban. However, the Phase 3 ATLAS trial that studied Rivaroxaban in this setting had several shortcomings. Before we embrace the use of Rivaroxaban in the management of acute coronary syndromes, these issues need to be addressed.